What you're about to experience is one man's quest to see beyond the tumultuous period we're in and to envision what lies just beyond our grasp, yet well within our reach. Welcome to Larry Rifkin's America Trends, where the future has arrived, and it's just in time.
Welcome back to America Trends. Larry Rifkin, John Kropsic. And John, have you ever thought about the fact that a doctor gets a lot of training, and yet the world that they touch is very personal and to some degree limiting, one patient at a time? And yet there are many doctors who I would imagine would like to touch a much larger world of public health and have an impact on a global basis or a regional basis. And I know it's got to be gratifying for so many to treat one person and to see one person improve. But I would imagine there are doctors who really look beyond that one person.
I think the younger doctors are getting more involved with doctors,
socially,
Doctors Without Borders and stuff. I think there's a big movement on do exactly what you're saying, move to, go to these other countries for a few months and help people that are third world countries that really need medical attention. So, well,
Dr. Paul Zeitz, who is our guest on this podcast, has done just that, John. But he's done it on a regular basis. He's got a new book called Waging Justice, A Doctor's Journey to Speak Truth and Be Bold. And he has really gotten himself in the middle of some of the most fascinating medical work across the globe, trying to deal with scourges that have, eluded us for a long period of time. And I think you're going to really appreciate the perspective that he brings. He served in the Obama and Trump administrations as the director of Data Revolution for Sustainable Development at the U.S. Department of State. I mean, this man is a remarkable human being, and he's a doctor. So he cares, he knows, he loves science, and he wants to apply it on a broader landscape.
Yeah, I think it's great. I think what these younger doctors are doing is really fantastic, because this is the kind of stuff that really America is all about. We're a very giving nation, and we should be doing more about this, and we should really hear more about this, because this is really good stuff we're doing.
Well, he will deal with the global fight against AIDS. We know that President Bush II was very involved in that, and he's got a lot to tell us today. So we're going to go along with him. Waging Justice, Dr. Paul Zeitz, here on America Trends. The book is called Waging Justice, A Doctor's Journey to Speak Truth and Be Bold by Dr. Paul Zeitz. And you've got a remarkable background as a physician and as an award-winning advocate for global justice and human rights. And I know that there are some people that you believe are very important to the field of medicine who believe that medicine should fulfill its greatest ends and enter into the political and social life of our time. Do you think more physicians should be more active?
Thanks, Larry, for having me on your show. Yes, I think physicians have a unique responsibility to, of course, provide the best possible care to the patients in their practices, but they have a community responsibility. And when there's injustice before them that is leading to bad health outcomes or killing people, then I think physicians have an opportunity and a responsibility to step forward. Recently, we've seen physicians who are managing gun violence actually come forward and take a political advocacy position on that, because they see that they are in the front line of that battle as well.
Do you think that doctors have been reticent at times, feeling that their responsibility was more on a micro level? In other words, this patient who's in front of me right now is my most important concern, as opposed to some of the macro issues?
I think the majority of physicians are focused on direct service and direct care of their patients, and that's totally legitimate and appropriate. But I think if they can, they have the opportunity to assert leadership in looking at it at the community and population level. And we are seeing an upswing in the number of physicians that look at public health, that look at the community impact of the environment and the cultural norms and the economic variations that occur that contribute directly to health outcomes.
When we look at the mortality rate in the U.S., it seemingly is showing us in a declining element of our aging, that we actually are dying at younger ages today in the United States, a very advanced country, obviously. I mean, should that be a wake-up call to physicians, for example?
Well, I think that your question brings me to a broader look at our entire health system and the way that we're investing money. We are investing more money per person per year than any other health system on the planet, and our health outcomes, as you say, are mid-range. We're like ranked number 30 to 40, depending on the indicator. So it's not surprising that our longevity is not as high as other countries, and those other countries are actually spending less money per capita per year.
And so where are we going wrong? What emphasis are we giving to different elements of our care, or is it the middlemen involved, the insurance companies and others? Why are we not being as effective if we're spending all these resources?
Well, that's a complex question, and it's multifaceted. I mean, I think that our healthcare system is focused primarily on curative disease. So if you're healthy and then you become sick, then the health system is oriented towards managing your disease or your illness. So we're heavily focusing resources and effort on curative healthcare. So preventive healthcare is neglected and underfunded. That's one big kind of transition that we could make. We could have a more balanced investment approach. Number two, we spend a large portion of the healthcare dollars at the end stage of life. In the last 2 weeks of life, we're spending a significant amount of the health budget. And that's because there's a cultural norm to extend the length of life no matter what. And I think that there's a hospice movement and a broader movement of people that believe that we should focus more on the quality of life and reduce the interventions that we're doing at that end stage so that people can transition more peacefully and without huge expenditures that actually have no positive outcome. So, and then of course the way that we fund the health system, the way that our insurance system is set up, where the insurance industry is a middleman, as you said, a broker between the patient and their doctors, and they're for-profit institutions whose interest is to make money for their shareholders, and so they don't always keep the patient's interest top of the mind.
Well, thank you for delving into that. I want to ask you one other question that's about the U.S. system, and then I will widen the focus a bit to some of the universal concerns that you've had and some of the battles that you have fought over the years. But when I look at our healthcare system, there are a lot of people who say that doctors themselves don't know a lot about nutrition and are the ones who look for the Hail Mary pass at the end because they don't tell us what it is and aren't prescriptive enough about the things we need to do to keep ourselves healthy. And I don't think we tell our doctors the truth often about what we're doing. And beyond that, you've got all these other industries, including the agricultural industry in terms of the food processing, that is fighting you tooth and nail. So you may get a message from your doctor, and then everywhere you go, from fast food to other food products, are sending the wrong message.
So like I said, our healthcare providers, our physicians and other providers are trained mostly on curative medicine. If you look at the medical school curriculum, there's very little attention given to doctors in training throughout their training on good nutrition. Primary care doctors pick that up as they go along, but they're not reimbursed and they're not supported in terms of prioritizing good nutrition as part of their medical practices. So that's a systemic problem for sure, in my view. Secondarily, you're right. There is a corporate-driven food industry that makes products that have unhealthy things in it like high fructose corn syrup and high content of sugar, which is addictive and unhealthy and leads to obesity and all the other negative health outcomes that we know about. So I do think it's about consumer demand, though, and consumers have to be educated and mobilized to select healthier options so that they can have a healthier lifestyle. And, the government has a role in this, too. There could be enhanced regulation, enhanced promotion of healthy options. We have seen that by some administrations in the past, but I don't think that's a priority of this current political leadership.
You have been a driving force in ending the epidemic of AIDS. You've looked at poverty, sexual abuse around the world, climate change, a whole range of issues. When you look at the most immediate public health crisis in the world today, I mean, we'll take your scope to where it's been historically. What do you see?
The most pressing issue for me right now is the climate emergency. Human population on the planet is rapidly increasing. There's about 7.3 billion people on the planet right now. We expect that there'll be about 10 billion people by 2050, a very short time from now. And so the good news is that poverty is going down and more people are living middle-class lifestyles, especially in India and China, and it's also occurring a little bit more slowly, but it is happening in Africa as well. And those people are burning fossil fuels. So the carbon emissions are increasing globally despite all the efforts that are underway. And I'm pretty convinced by the scientific evidence that we're on a pathway of exceeding what the experts are calling our planetary boundaries. The human species is overstretching the ability of the planet to sustain human life as we know it. And there's a mass extinction underway right now. Amphibian, fish, and mammal species are rapidly being decimated, and I think that's the greatest threat to the human species itself.
Is that the canary in the coal mine? This ecosystem is out of balance when we see a lot of animal extinction. Is that a telltale sign for us?
I think, this is the fourth mass extinction that we know about in the recorded history of Earth, or the studyable history of Earth. And it is a canary in the coal mine. And I would say the changing weather patterns and the intensification of the storms and the warming of the planet, the data is incontrovertible, are all the canaries in the coal mine. The canaries are chirping really loud right now. And the good news from my perspective is that we as humans are genius. We have the capability to transition to clean and renewable energy extremely rapidly. And this is the decade where I hope that we'll be ushering in that new era. Also, I think there's new technologies that are being developed to do what's called climate restoration, which is sequestering carbon from the atmosphere, enabling us to restore the climate, to optimize the well-being of the human species and other aspects of the planet.
Do you feel that this middle-classation, if you will, of many countries, and it is going on, and that's a good thing that people are moving out of poverty, but they are not perhaps as readily adapting to some of the new technologies? America, without a lot of encouragement at times from the government, has been doing a good deal through the private sector as well. Are you worried, for example, about China in this equation?
Well, China is the leading global emitter of greenhouse gases right now, and with 1.3 billion people and a rapidly expanded middle class in the last 20 years, and that continuing going forward, yes, they have a major opportunity to help lead the transition to clean and renewable energy. There's some actually really amazing things happening within the provinces of China itself, where they are transitioning, they are bringing new technologies, and they are building renewable energy sources. One of the challenges, though, of their policies right now is that they're still exporting extractive industry, coal and fossil fuel industries, to countries in their orbit. So while they're doing some good progress domestically within China, they're still exporting extractive industry technologies and building coal plants, for example, throughout Asia in countries that are dependent on China's wealth. We have a lot of work to do to bring the Chinese leadership and the Chinese people into the global movement to transition to clean and renewable energy.
What can we learn about the fight against AIDS that you waged? And in fact, that helped to elevate a lot of your social consciousness, you seeing some tiny coffins on the roadside. And if you'd like to share that very personal account with us, and then tell us what we might have learned as to how we dealt with HIV/AIDS going back to the 80s and 90s.
So I was living in sub-Saharan Africa in a country called Zambia, which is in the southern Africa. It's a landlocked country. It was a former British colony known as Northern Rhodesia. And I was living there in the late 1990s. And I was a public health doctor. I was working on child health issues mainly. But while living there, I realized that HIV was leading to AIDS, and the death rates were starting to dramatically accelerate. And I was aware of that from an intellectual level. And one day I was driving along the road and came across a Christian Aid youth project, and they were selling coffins for adults and for young children. And something in my consciousness, an alarm bell rang, and I said, I am no longer going to remain complicit or complacent in the face of this AIDS Holocaust that was in front of me, where literally thousands and millions of people were dying. 35 million people have died of AIDS so far. So I came back to Washington and joined forces with many other stakeholders, and we built a cross-partisan or bipartisan movement from the far left to the far right to save lives. And that led to President Bush announcing the emergency plan for AIDS relief. That's President George W. Bush in 2003. And we were able to, the political movement was so powerful, and because it was across the political aisle, that President Obama continued that effort. And just last week, President Trump recommitted the United States to continue this bipartisan effort to end the AIDS epidemic. So the lesson for me is that Americans can come together. We can find common ground. We can bring our genius and our innovation and our can-do spirit to solve major complex global challenges. Everyone told me it was not possible. We could never get the U.S. government to do what they ended up doing on global AIDS. So people are skeptical. People think we can't solve the climate crisis. We can't end poverty. We can't get better health outcomes here in the United States for value for money. I say we can.
Dr. Paul Zeitz is with us on America Trends, Waging Justice, a doctor's journey to speak truth and be bold. You have looked at public health as somebody who is most concerned about it in the broadest sense. How strong is the U.S. public health system vis-a-vis, say, other developed countries?
The United States has a top world-class public health system. We have the Centers for Disease Control and Prevention, the CDC, which is out there leading the effort in the United States to identify patterns of disease, identify risk factors, and deal with urgent crises. So, for example, the recent recall of romaine lettuce because of salmonella was due to the kind of vigilance of the CDC and the U.S. federal capability. We also invest tons of money and have world-class researchers at the National Institute of Health that are pioneering, trailblazing, cutting-edge solutions to health challenges. And I think that we lead the world in that. The work of CDC and NIH and our federal-level agencies is being replicated in parts of the world. They just, 3 years ago, launched a CDC for Africa. And the kind of level of investment that we have from NIH, the National Institutes of Health, that is developing medical solutions and responding to public health analyses is unmatched around the world. We are seeing China and other Asian countries step up and start doing more investment in those areas, and that's great news. Let's work together with all leaders from Europe and China and around the world and Africa and Latin America as well to collaborate and bring our best intelligence forward to help the whole human race.
What about the media? And we're a part of it. Just about every year or two, we hear about some airborne or avian flu. A new world pandemic is predicted every few years. Is there that likelihood, or are we, as a collaborative public health unit around the world, able to deal with these things as they begin to develop?
Well, I think the United States has a very strong surveillance system that can identify infectious diseases like avian flu or influenza or other things like that. But I would say that it's not equal everywhere. The global system is still relatively weak. And in response to the Ebola outbreaks that happened in Africa several years ago, there has been a momentum around global epidemic preparedness and health security, it's called, as a whole endeavor. And there has been investment that has increased, but I don't think it's sufficient yet to enable countries in Africa and poorer countries in Asia to actually develop a surveillance system, a monitoring system to identify epidemic disease early in its track and be able to report it and make it actionable. The leadership of the World Health Organization is working on this, but it costs money, so it takes investment. And I don't think we're where we need to be or where we could be to really have a global system that would protect all people.
When you hear medical conditions thrown around as the reason not to allow refugees into the United States, and we hear these things like smallpox or diphtheria or leprosy about refugees, I mean, what does it say to you when you're looking to wage justice and you're hearing medical terms thrown around to disinvite people into the country? As a doctor who cares about these issues, what does it mean to you?
I think I think that there's a way of protecting human health, both of people who are in a refugee situation, to make sure that they remain healthy, and to protect the populations that they're coming into. So it's a false dichotomy. It's a false notion that you could say that we have to keep people out because of the health risks. We can actually manage the health risks, keep the populations here safe, and have an appropriate refugee integration and immigration program. So, I mean, smallpox was eradicated in the 1970s. I can go through each of the diseases. There is no transmission of smallpox on the planet, and there hasn't been for decades. So that's, ridiculous.
I know, but it's still bandied about. We're still having an immunization debate in the United States. A lot of people are anti-vaxxers. Are you surprised that America still allows those kinds of conversations to be seriously contemplated in public debate?
I'm not surprised at all. I mean, when I worked for CDC many years ago, I was living in Arizona, and we had a measles outbreak, and it was because there were communities that didn't believe in measles vaccination, and so a whole population of young adults got measles and mumps. And so I've been actually at the front line of those kind of situations. I'm a strong believer in science and data, and the data is very clear that when you get at least 80% of the population vaccinated against measles, then you create what's called herd immunity. So the whole population is protected. And so I think it's a balancing act between individual judgment about safety and efficacy and the collective good to contain these epidemics. So I'm I think vaccines are safe and effective. The risks are extremely low, and the benefits are great, not only for the people that get the vaccines, but for the whole community.
Is universal access to health care one of those causes that you will continue to wage justice for?
Absolutely. It's a top priority. I believe that we can achieve universal health care globally. In fact, the UN system is having a major conference to that effect in September of 2019. And, the United States, I think there's exciting momentum politically to bring forward initiatives to go beyond where we are now into Medicare for all to ensure health care as a human right.
In closing, you have said, as physicians, you will be on the front lines of what happens in human society. But wherever you are, you have to make a choice to really see them, and you put see in quotes, or not, to really see, again in quotes, the injustices before you and investigate them, interrogate them, and seek solutions to radically and rapidly dismantle injustice or not. So where are we in terms of the two types of physicians that can be out there, those who see and those who don't? How confident are you that we're moving in a direction, as you have, as a physician who wages justice?
Well, I share in Waging Justice, my memoir, times where I did not see the injustice before me, where I was complicit or where I was complacent. So it's also a self-accountability opportunity for myself. So I think everyone, including all physicians, it's a constant opportunity to reflect on, do you see the injustice before you, and what can you do about it? Can you use your voice, your resources, your institutions to take seriously the opportunity to dismantle the injustice? So obviously there's a ton of injustice still going on in the world, so we have a lot of work to do together, but I'm very optimistic about where we as humans, where we as Americans can go if we join forces.
Dr. Paul Zeitz, thank you for being with us today. The book is called Waging Justice, and we thank you again for coming to America Trends.